The basic research that's been done in this area in the social and behavioral sciences has had many findings. But the research has lacked clear knowledge about what's most important and what isn't. And we certainly didn't know how the different behavioral factors line up and form social process that defines how information about getting ready and mitigating and preparing is converted into actual behavior. In other words, this set of balls describes the state of knowledge a few years ago. And there are agencies in this room that fund people to do surveys that document itty-bitty tiny correlations between factors like status, that's the ball on the upper left, roles, gender, socioeconomic status, education, income, etc., experience, cues, information received, knowledge, information belief, perceptions, risk perception, milling, which is one of the balls I contributed to what's up there, and then finally behavioral action. But that's where our knowledge was until a few years ago. We now know exactly, precisely, and definitively how you motivate Americans to mitigate and prepare for hazards. There are no questions about it. Are you on the edge of your seat? A mega study was funded. DHS funded Linda and myself, and they said you can have all the money you want. We had so much money, we turned back money. It was, in the world of social science, the Manhattan Project for Public Preparedness and Mitigation. We studied public preparedness and mitigation for any reason. We took the money to study terrorism because they're interested in terrorism, but convinced them we needed to study it for all the other hazards as well. Because if you have a flashlight for one hazard, you have it for another. They bought the argument. And we tested every predictive factor that exists in the literature. And the findings that resulted are impeccable. And we have impeccable evidence, and I'm here to share it with you today. The findings are clear, they're consistent, they're replicated. The findings are talking about individuals and households, not governments, but recollect that the grassroots from time to time can influence local government action. Here's the sample the mega study was based on. 3,300 statistically representative participants in the study, representing every single person in our nation. We also oversampled New York City, so we could have a basis for perhaps talking about what's going on there. We oversampled Washington, D.C., and we oversampled Los Angeles. We selected those communities to oversample because they're terrorism relevant. And we also oversampled different racial and ethnic and minority groups, Hispanics, African Americans, Asian and Pacific Islanders, and the fastest growing ethnic group in America, people who self-classify as other. That means they're a little mixed up in terms of their racial and ethnic heritage. Those numbers, as any statistician would know, are not large enough to be able to generalize to those subpopulations, but you can still analyze the data. What we did was correlate every one of the dependent variables about preparedness and mitigation, and that pyramid was an outline of them, with all the different, I don't expect you to be able to see these numbers. I just want you to see what a zero-order correlation matrix looks like. So we know about how gender correlates with all the different behaviors. We know how education level correlates with all the different behaviors. We know about how all of them correlate with all the different behaviors. And that's the kind of analysis you typically get from a polling firm if you do fund a pollster. Nothing wrong with pollsters, it's just not science. Here's what the zero-order correlation matrix showed. virtually identical conclusions as everyone else who ever has done this kind of research. That's no big surprise. Dozens of factors correlated with these behaviors, most of them very weakly, with public readiness, preparedness, and mitigation action taking. What the mega study did next was to try to identify the key variables and processes that motivate the public to prepare and mitigate. Our approach was to start by examining all the factors that anyone had ever found to correlate with these variables. We used an analysis approach informed by theory that you'd have to be a social or behavioral scientist to know. And we wanted to end with a short list of key factors and how they form a human social process so we could tell you, so you could use that information. We constructed models, and these boxes have words in them like demographic factors that are surrogates for all the different demographic characteristics, because if each of the different factors had a box, it would be incomprehensible. They were sequenced in the way that the research suggested they would be sequenced, and if there is cause and effect in the social and behavioral sciences, this would be our attempt to construct a causal model. And then we statistically estimated the models. So I don't expect you to be able to see this, but that's what sociology looks like. One of the things it enables us to do is be able to see if the correlation between gender and mitigation disappears when you control for everything else that's in the model. It enables us to see if there are spurious relationships that are not real, etc. And it enables us to zero in on what's really the most important. But you have to be in love with statistics. And fortunately, Linda and I both are.